Okay, for the elbow evaluation, we would start with a history. We would take a past history and present history, inspect for swelling, discoloration, and deformity. And we would also inspect for their carrying angle. How are they walking in the clinic? Are they walking in with one elbow held up like this? Are they kind of out in a valgus? When they hold their arm down like this, are they holding their arm out like that? Or are they sort of like bow-legged at their elbow, called a gunstock deformity? So we're inspecting for all of those different carrying angles. Palpation, we would start with bony palpation up at the shoulder. So up in the bicipital groove, so you could have them make a bicep, push up against me, and then you could follow their bicep up into and through the bicipital groove of the humerus. Palpate the shaft of the humerus down to the medial epicondyle, the bony prominence sticking out on the medial side. Palpate the lateral epicondyle of the humerus on the lateral side. The olecranon fossa of the humerus is difficult because the olecranon process, which is this extension of the ulna proximally, this olecranon process is sitting in that olecranon fossa. So underneath this process is the olecranon fossa. Then you would follow the ulna. So if we're in anatomical position here, the ulna is medial. So you'd palpate the shaft of the ulna and both the proximal and distal ends of the ulna. And then again, the same thing for the radius. Laterally palpate the shaft of the radius and then both ends proximally and distally. Soft tissue, we'd palpate the biceps brachii on the anterior side of the arm. Posterior side, we'd palpate the triceps brachii. For the wrist flexors, we have a picture I want to kind of show you guys as I go over it at the same time, which I'm going to bring up in a second. Okay. So we have the pronator teres for the wrist flexors on the anterior side. The pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Now, if you kind of look at a picture of those muscles, you can see them here. So you can get particular if you want to palpate. Obviously, the flexor carpi ulnaris is more on the ulnar side, while the flexor carpi radialis is more on the radial side. So if it helps you to visualize that way, you can have your book open. You can Google the flexors if you want there. Then we move on to the wrist extensor. So your extensor carpi radialis, extensor carpi ulnaris, extensor digitorum longus. And we have that for you too. Right there. And again, you can see the brachioradialis in this view as well. Extensor carpi radialis longus and brevis, extensor digitorum in yellow. Extensor carpi ulnaris, again, more on the ulnar side of the extensor, the posterior side, in purple. Moving on to the brachialis is difficult. It's under the biceps, so you can kind of palpate the brachialis this way. The brachioradialis, if you make a fist, and then you can see this brachioradialis muscle that kind of sticks up here on the forearm. That's the brachioradialis. The ulnar nerve runs through the medial elbow. So there's this notch in here where this ulnar nerve runs through, called, if you hit your funny bone right there, it sends, or if you tap right here, it'll send kind of zinging signals down to your fourth and fifth fingers. So that's where your ulnar nerve, that's where you're going to palpate it right there on the medial elbow. We'll move on to the medial collateral ligament on the medial side. Palpate that. On the lateral side, you have the lateral collateral ligament. Those are also called the UCL and the RCL for ulnar collateral ligament and radial collateral ligament. Your annular ligament holds down the head of the proximal head of your radius. So if you follow your radius all the way up and find that head of your radius up here, you can palpate the annular ligament in there. For range of motion, you're going to state that you would do it passively and actively. I will have the patient do it actively. So I would have her flex her elbow to 155 degrees, or should be 155 degrees, and then extend to 0. Forearm supination should be 90 degrees supinated out, and then pronation in 90 degrees this way. And then go ahead and relax. So for muscle strength, elbow flexion, remember you always want to have a hand that kind of is a base hand to hold you sturdy. And then you're going to, through one full range of motion, you're going to pull up, elbow flexion, pull up, pull up, pull up to test the biceps brachii, the brachialis, and the brachioradialis. Then you're going to have them extend, push, 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 push through one full range of motion, triceps brachii and anconeus. If you wanted to go through multiple ranges of motion, you're getting muscular endurance added into that. Forearm supination, again, you can hold the arm here, shake hands here, and you can resist supination. So she's going to try to open her hand, right? Like she's trying to hold soup. So she's going to try to go through that motion while I resist her the opposite way. And then, so that is testing for the supinator, biceps brachii. And then forearm pronation, you're going to do the opposite, right? Resist pronation for the pronator teres and pronator quadratus muscle strength. Moving on to the neurological testing, motor, you're going to just copy what I do. See if they can C5, use their deltoid, then relax. C6, extend their wrist. C7, extend their triceps. Probably do it with your left arm. Flex your wrist, use your wrist flexors. Finger extensors. C8, finger flexors. T1, finger add and abduction. For sensory, go ahead and relax. Again, you're going to draw that same pattern. So C5 is on the anterior central lateral forearm. You know, do you feel this? The same on both sides, essentially, right? C6, thumb. C7, remember, middle finger. C8, fifth finger. You guys can't see. And then T1, anterior central medial forearm. For the reflexes, biceps, you know, you're going to have them relax here, relax. Hit the biceps tendon for that reflex. For the good of this class, that's enough. C6, brachioradialis tendon, support them here. The tendon comes down, right? And just hit here and see if you get that reaction from the brachioradialis to test C6. C7, bring them back here. Hit the triceps tendon at the elbow here and see, check for that reflex for C7. And finally, blood flow tests, radial pulse. So you would check the radial pulse here for 15 seconds. Remember, don't press too hard or you'll occlude the pulse. And then you're going to report it in rate, strength, and rhythm. So if I get 20 beats in 15 seconds, I multiply that time, or 25 beats, I multiply that times 4. You're going to get 60 beats per minute, and they're pretty strong and regular. Now, if they're not strong and regular and it's weak or thready or a different rhythm, then that's not good, but you'd want to report that. Capillary refill, again, if they're wearing nail polish. Oh, look, 1 is not wearing nail polish. So we could use the 1 and press and then let go. The color should return in less than 2 seconds. Or we could use the fingertips here, let go. The color should return in 1/1000, 2/1000. On the paper, it doesn't say compare bilaterally, but you definitely would. And let me know if you guys have any questions. Have fun.